that it kills. So she went to Alliance, she did some part there, this and that. And one day I was upstairs and I heard that somebody wants to see me. And I now said, who is the person? They mentioned the name. It sounded too familiar. And I saw one tall, fair, and beautiful lady coming upstairs. Definitely, I don't know her because the person I saw was like a stick. In fact, she was already gone. Okay. Now, so she came up and she's like, Dr. Susan, it's me. I said, you who? And she now I looked closely. I didn't realize because of her cancer state that she was a tall, fair, and extremely beautiful woman. And by God's grace, we sat down and we spoke. And she told me that I was able to control her mind. Her anxiety disappeared. She believed that she can shrink it to a grain of sand to a point where it can just be kicked out. Number two, that wedding that she did not want to attend and she had picked somebody to attend, she attended that wedding. She doesn't have hypertension anymore. She doesn't have diabetes anymore. She's on cancer remission or, disappeared. There's this group, they call them survival cancer list, etc. Why am I using such a powerful example? I've known your mind as medicine for a while, and that's why I put a whole chapter on your mind as medicine. But when I repeatedly, remember when I come to this lecture, I'm not giving you internet or textbook. I'm always bringing real life African-based patient experience to this lecture. So I now listened to her carefully, and I've been convinced, but I was further convinced that if all of us will train our mind and totally see and believe, it may not be overnight, it may not be 3 months, it may not be 1 year, but I want everybody to actually, if you can, outrightly refuse to be a part of sickness. That is one. Two, the lady, she just thanked me and she left. And she just said that anytime we want to do a video, one of those videos we put in Dr. Physic Wall, that she will come and do a documentary video for us, which I know that I've not called her back to do that. But that, for me, fixed it as your mind as medicine. Now, the second example I want to give is on another patient, which I have used that example here severally, and some of my staff, my team colleagues that are on this phone, they know who I'm talking about because I just cannot use the name directly. So the second one is this man who he slumped because, in fact, today there was a 44-year-old guy that slumped. Last week, a 48-year-old slump. People are just slumped. I don't understand what is going on anymore. So he slumped. He went to one hospital. He stayed there for 2 months. Another one. Finally, they knew that he has to die. So the hospital now sent him home so that he can go and just, because sometimes they don't send you home to die. They send you home because they know that maybe your home environment can calm you enough for you to just sleep off, because some patients are just stuck between life and death, and you just cannot take a gun and shoot their head, no, or pull anything. Sometimes you send them home without fluids and all that oxygen mask and stuff. They can easily. So this patient was on the way home, and someone called me and said, Dr. Susan, we want to bring this patient to your hospital and this and that. I was like, no, this one, we've never signed a death certificate. We don't know anything about death in Dr. Physic Clinic, that we cannot accept this. If all these big people could not do it, the person said, take. So this patient came to the hospital. Now, why am I using this patient as an example? To God be the glory. From the first oxyvite we gave the person, the leg started moving, the hand moved, the body moved, I had a dream and I saw that we were taking a slow walk together. And I told the wife, I'm bringing that because even in your mind as medicine, the people around you are the people that will destroy your mind as medicine. The people, so it's not about you alone, it's about who is closest to you and your ear. So the wife of this man partnered with me. She believed everything I said. And she believed that, you know what? Because when she first came on day one, she's like, I don't know. Because where she was, they've already told her that this is a finished case. But when I now told her, Mom, you will sit down. We will not rush. We are going to do like this, like this. I'm sorry, I have to use only in-hospital examples because it's better because this one I can, swear by. So she believed, I would say, add egg and what is this thing? Broccoli, mix it as a drink and give him. She will do. Give water with the
Báwo ni?
cup, she will do. Do this, she will do. Do that. In the long run, that patient became well. So the second lesson on this, your mind
Tọ́lá
as
fẹ́ náwó.
medicine, please mute your mic. The second lesson on the mind as medicine is that people around you, so even if you will fix your mind as medicine and you're doing your own part, just the people around you, if they have negativity and they don't believe that thing can go away, it will not go away. So this was a man in coma, but the wife was now doing the mind as medicine for the husband after a talk. So mind as medicine is not only you, your environment is going to influence your mind as medicine. To God be the glory. The person did not die. The person is up and about, even though slowly he can walk, but if he needs to move somewhere fast, he needs to be on wheelchair, and he will come out of that wheelchair too. So this is what another example of mind as medicine. The last example, before I just show some scientific facts on how truly this is not about talk, this is about science, is on one Catholic bishop. So this Catholic bishop came, I think in Nigeria, I want to use this opportunity to let you know that, disease can stop by. If you have malaria bite, it goes. But don't overly believe that a disease can kill you. That alone is half the problem solved. So they were preparing him for death. And, in the Catholic Church, I believe that because of hierarchy, they've even brought another bishop that is going to take over. They've even decided where he's going to be buried, all this stuff. So all of a sudden, this man all along is being alive and preparing for funeral. And every time he checks, the PSA keep going up because it was a prostate cancer issue until the man came to us. And I now said, you think you're gonna die? He said, oh, this God calls home. I said, if God was calling you, you will not come to this place. You've missed road. So because we don't believe in people dying. So you're not gonna die. And for some weird reason, why am I giving this example? Will tell you that you're not going to die. It could be your wife, it could be your sister, it could be anybody. So I now told him, I said, no, that over here people don't used to die, so because you will not die. The same thing happened. I now told him that please reduce the anxiety. Before you know it, for the first time, the PSA came from 76, it came to 68. From 68, it went to 52. From 52, it came to 39. From 39, it went back up to 51, and the man lost hope. Why am I bringing that example also? Is because when you're in the journey of fixing your mind as medicine, if something changes along the road, You just give up. Why would you give up? So this thing came to like 30 something. I don't know what happened. Well, the truth is that I know what happened. A small infection entered, and the thing jumped back all the way to, I think, 51 or 49. It just went by like 10 numbers up again. And the man said, they told me that this thing could not be cured. I said, sir, but you believed that it could be cured. You fixed your mind on a clean prostate, a cancer-free body. That is what you fixed your mind. And only one bad result. Look at how you are. So we now gave the person, put the person on doxycycline for like 30 days straight. I know it sounds unconventional, but sometimes we do unconventional things to get results, alongside probiotics to also replenish the some of, because the any antibiotics will kill both the good bacteria and the bad bacteria. So we also found a way to replenish those bacteria. There's a way to manage it. So the next result, it came back again to almost the same number, 30 something, not significant. Then it went. And at some point, we were seeing 17. We saw 9. And he started writing books. They even gave him back his parish, or is it parish or diocese, and whatever they have. They gave it back to him. When he went back, a very good Samaritan now told him, Bishop, how could you have, I'm talking to over 100 people, so I'm certain in what I'm saying. How could you, you have to go to America and this and that, and went ahead and paid for every single thing. And so the bishop said, I will, because everything is paid for, I will go abroad and do this thing. So the bishop went abroad. Well, for me, if it is, in fact, when it comes to cancer case, I'm here telling you that I will not recommend US for any foreigner, because if there's opportunity to use you as an experiment, if there is, they will use experimental drugs on you because you don't have insurance, you cannot fight the system, etc. I don't know. I don't believe anybody will deliberately do bad to anybody, but they're always looking for opportunity to test new drugs and everything. This person that almost got his diocese back, everything was stated. By the time he came back from America, he came back on a wheelchair. And that time we were living on the 3rd floor. Our Dr. Physique was on the 3rd floor. So because of that, he could not come upstairs. We have to carry wheelchair and push him upstairs. So one person says that they should take him to Daughters of Charity. So they now took him to Daughters of Charity, which is a very good hospital, but it's still hospital environment. So the whole story on how cancer kills and this, I don't know, for some reason, that is where he actually died. But he was, I don't know. I feel like we always agree on our platform, when God says you will go, is when you will go. You will sleep and go. But I've also I had to use that example, even though it ended up that he died in Daughters of Charity. But I could see how a mindset over time could just kick out a disease from the body. So I know that the story is long, but I want you to use these few examples to know that your very mind, according to Hippocrates, is the most potent force of healing that you have. So it doesn't matter what you have. I'm going to go to some scientific data to show you, some of these things that I am talking about and how it really works. And I hope my story was not too long, and I hope you understood a little bit. But the most important thing is that I want you to fix your mind 110% on what you want. You fix it there. It doesn't matter what the fluctuations are. This is what I see. You see that, you wait on it. Sometimes, as soon as you fix your mind on something good, one small devil will show up to disrupt your mind. Tell the devil, I cannot hear you. I am fixing my mind on what I want. And for this community, we are fixing our minds on a sickness-free body. Every organ in our body works well. And all our wish is that when God says you go, you just sleep and wake up on the other side. That is our wish. And we don't want to be a burden to anybody in this life. So that is that. Now, let me see if I have one small lecture that I opened up so that we can look at it together and then wrap up. So I know that so far it's been stories, but these are real stories and story, not internet. I have internet story where a person said, this fridge unit will kill me. And you know what? The person died inside a fridge that had normal temperature because the person believed that the fridge unit will kill him. So you can actually repeat, I'm going to die, I'm going to die, I'm going to die over time. Your body will secrete what will kill you. I don't want to teach you how to die. I want to teach you how to live. But this mind is very, very dangerous. And you can use it in any direction that you want, etc. So that is that. Now I'm going to share my screen. Before I share my screen, I want to open and make sure that everybody's not sleeping because I did not hear your voice. Okay. All right. All righty. All right. So I'm sharing the screen now. Start broadcasting. So that, I hope the screen is being shared. Screen share, start.
It's about to, doctor.
Oh, well, okay. Let me try one last time.
Okay.
Is it coming now? Okay, thank you so much. Yeah, I'm so happy for that feedback. Thank you, sir. Because sometimes it's very lonely over here. Okay, so today's lecture is supposed to be on your mind as medicine, your very mind as medicine. Medicine must not be a tablet. Even though in Dr. Physics we have said water is medicine, we've defined our own medicine. Now today we are defining the mind as medicine. So that is where we are. I had a little quote that says, if you change the way you look at things, the things you look at change. That woman changed the way she looked at cancer as some big, mighty, overwhelming thing that must kill her to just a sand pebble. And she used to carry the sand, anywhere she's walking, she'll carry a sand pebble and be rubbing in her hand and believed it. And the cancer was kicked out of her body and she attended the daughter's wedding and she became whole. So if you change the way you see things, what you look at will also change. For those of you that have hypertension, diabetes, obesity, stop saying, I am diabetic. Anything you use, I am, is a personal this thing. I taught here on this platform, when you're calling this, call it detached. Doctor, diabetes is there, as if it's not in your body, because it's not in your body. Diabetes is, don't be so personalized, don't so personalize it. I am a diabetic. Malaria is my disease. There's one general that comes all the way from, I can't say where, so that we will not trace the person down. He says, that one, leave him. Malaria is my disease. And I said, sir, malaria is not your disease. So he now did one or two things. Right now, he will send a truck, because he's a military general, retired, to come and pack water all the way from Abuja to Eastern State, because maybe he believed it's the water or whatever. So he's not had malaria again. But when he came, he said, malaria is my disease, it's me, that is my own. So let us start talking about diseases detached. If there's a BP, the BP fluctuates yes, there's BP. Talk about it detached. Not I am a BP, I own BP. I'm just advising. Yes, BP is there in the body, but don't be so clingy just in case it wants to go. But if you own it and protect it and all of it, there's no way to go. So shrink how you see diseases, drop it, bring it down, detach from it. I personally believe that only from this lecture somebody's going to have a really, really good testimony by changing their attachment to anything that they're seeing in their body. It will get out if you don't give it this thing. Now, so the objective was actually to, help you understand how thoughts, emotion, and mental habits can influence your health. Okay. So, as a way of introduction, which I've already done that, the human mind is more powerful than you can ever. Are you kidding me? What about that woman on Oprah Winfrey's show that actually lifted a car with hand because a baby was under the car and she believed she could lift the car, and with her mind she was able to lift up the car. It was on Oprah Winfrey's show, and they pulled out the baby. So this is how potent the mind is. We just have to understand the potency of the mind and start using it accordingly. Okay. So it says, let me see all these, we share our notes. So let's see. So the third one says that this concept of mind as medicine emphasizes what? Thoughts, emotion, and mental habits, and how it plays a role on our health and preventive medicine. So I've already talked about, the mind body medicine uses powerful thoughts and emotions to influence the physical. The reason I used all that story is that by the time I come to the lecture, you're like, okay, you've already said it. So, as we can see here, and I mentioned earlier, the natural healing force within each and every single one of us is the greatest wellness we already have. You see, by the time you think sickness, you're secreting things that you're bringing out manure that produces sickness just by thinking. I always use a very vulgar example. Anything you're thinking and believing in your mind, you're producing it on your body. I've used it before. If you're thinking about sex and you just visualize a woman and you're just thinking of a man and you're just thinking sex, you will not know when you've gotten an erection. So your body does the work for you. Use that one to remember anytime you think about anything. If you're thinking of a very, very sad situation that you will just be sitting there in your dining table, tears will just fall your eyes. So you can see that we actually secrete things. We secrete hormones that either heal us or kill us faster. And it's from the mind. You can sit there and you have such a happy thought in your house, only you start laughing, laughing. And if somebody's just looking at you from outside, they say, is this person mad in this economy? Why is the person laughing like this? So this is to tell you how powerful your mind is in terms of secreting either healing stuff or killing stuff. Okay. All right. So there are so many signs that shows that when you numerous scientific studies have shown that mental and emotional, even stress, can influence immune health, endocrine system, and even the nervous system. We've talked about it. So let's go straight to it. This mind, how does it impact your health? You can just be sitting here. What does not concern you? Because we've heard it from all the holy books on earth that says, be anxious for nothing, that God will take care of our need. Now, you're sitting there and you're thinking of what will happen next year, next month, this as if you have control over, and you start secreting high cortisol, adrenaline. As you're sitting there, BP has gone up, you're having manure for cancer, etc. So the point is that stress, which is a mind game, is enough to impact your health negatively. It can lead to anxiety, depression, digestive issues where you have ulcer, bloating, constipation, obesity, and then heart diseases. Another how the mind impacts, you remember we're talking about mind as medicine. So we also have to talk about how the mind on its own impacts health in general. Thoughts and recovery. Research shows that patients with hopeful, optimistic outlook recover faster from surgery and illness. You see, I gave all the examples in the beginning. Negative belief and fear can actually delay healing by creating tension, reducing immune function. So when you have negative belief, you're secreting negative hormones. When your cortisol levels and other inflammatory things are so high, how are you going to heal? You cannot heal. So there are some tools that we can use. One is mindful meditation, being present. Even after this lecture, if you're by yourself, just sit down and close your eyes and just visualize that your body is perfectly well and disease free. You have to first see it in your mind's eyes for it to happen. Two, you can do deep breathing exercise, because the deep breathing exercise, which we have learned, we even did oxygen therapy, I think last week. That same oxygen as medicine, you can use it for meditation. As you're doing your deep breathing exercise, if you do it like 3 times, you'll be so calm in a way that your body will rest. Your heart rate will reduce. As you saw, they taught us even your BP will stabilize. And before you know it, your whole body will start healing itself from just the deep breathing. Another tool, which is my favorite tool in the whole world, is gratitude practice. If you have a journal, just by bedside before you go, I am so grateful for my health. I am so grateful for my leg. I'm so grateful for my knees. No matter how, just be grateful. If you thank somebody, they do more for you. If you thank someone, they will do more for you. So then how about God? Because God is the owner of everything. So if just a mere man or woman, you say, oh, thank you so much, and they did more for, how much more the owner of everything? You just thank him. He will just melt for you. So write it down. It secretes things in your body, positive things to heal you. Visualization. You can visualize yourself as perfectly well and fix that visualization in your mind. Okay, the book called Gain and Gap is, I think, is about the best book ever that I have read. It's about, especially for us that are very ambitious in life since we were grown, your daddy will always tell you, your mom will tell you, you can be first, you can be this. You grow up not even remembering what you've gained. You live in the gap. One of those, when I have, I will be happy. When I become, I will be happy. So you live in the pocket of gap to where you want to be. You did not finish building your house. It's remaining half. You're like, you, instead of taking your mind that, I'm even in a really beautiful place now. Let me just manage. You don't even remember that. You leave your mind permanently in that gap. So this is what the book teaches, that most of us, we live in the gap, and that is why we have so much issues, anxieties. We can't even make right decisions. Come back and live where? In the gain. So while I'm looking for figure 8, I'm going to first thank God that, God, I am so perfect that not even one comma came out of my lab work. So just always bring yourself back to to the gain, while I'm looking for whatever I'm looking for, I'll have to remember that I'm even walking with my two legs. I'm even seeing with my two eyes. I'm even hearing with my two ears. So, gratitude, visualization of positive things, in this case, positive health, will actually promote and increase positive health. And when you start visualizing, one small Satan will come and pinch you in your bum bum. You're like, you now bring your mind back to that place so that you can come out of the gain and live in the gap. Come out of the gap, live in the gain. The book, I think, is still The Gain and Gap. It starts by saying that there's an Olympic, all these people that win gold medal and this and that. Generally, any book that you read about athletes, before they go to bed, they must have like a mental video where they see themselves running, they see themselves winning, they see themselves collecting the trophy, they see how people are clapping for them, they see the joy. You have to be doing that mental video every night until you collect your trophy. There's not one Olympic person that won that does not have that as part of their coaching program. They have to see it because they cannot see it in their mind's eye. They can never be an Olympic medalist. So the point I'm making is that visualize what you want. These Olympic people, they use 3, 4, 5, 6, 7, 8, 9, 10 years to practice, but in the long run, they get the medal. The question is, how long are you willing to practice your visualization until you get what you're looking for? And then how often are you going to give in to any small distractions that come to disrupt your mind that you're not going to be well? Affirmation. My bathroom is my affirmation space. As I entered, my body is perfectly well. I wash away any type of sickness. I'm happy and jumpy. I do two things in the bathroom. I'm either listening to a very, very inspiring, motivational type of gratitude, something in the bathroom, or I am praising, like, who will praise you from the grave? Like you appreciate, no matter how you look, you need to just say, God, am I not walking? Am I not seeing? Am I not beautiful? I am perfect for you because God loves you so much. If you see like some of these parents that have autistic children, handicapped children, etc., if a physical earthly mother and father can love a child that, according to earth's look, that child is not perfect to earth, and the mother can, how much more God will love you the way you are. So you have to affirm that you're perfect as you are and you're perfect in health. Say, maybe from next lecture, we'll start doing our health affirmation, which says, my body is perfectly healed. My cells are totally healed and energized. I have a totally sickness-free body. You just keep repeating that constantly. And let me tell you, before you know it, you will see it. So finally, I know you will not even doubt it. In New England Journal of Medicine, there was a Harvard study that clearly shows how meditation was used to reduce things like blood pressure and inflammation in the body. So, but we don't even need to go as far as Harvard study. I put Harvard so that if you don't have access to Dr. Physique data and things, at least you can Google. You can see that there are so many studies that have been conducted that shows that meditation, like even yoga, they call it over there, but just deep breathing exercises, meditating on your own type of God, on your mind, on what you want, it changes the equation. Okay. And then placebo effect demonstrate. You've heard about placebo. So placebo is when they are bringing a new drug. They give this, let's say there are 200 patients. They will give 100% the real drug, and they will give 100% maybe just vitamin C. And you'll be so shocked. 70%, see the bottom, up to 72% of the people who did not collect blood pressure medication and collected vitamin C, their BP will come down just because they took a tablet to their mouth. This one I saw with my eyes when I was doing my clinical rotations, where in a cancer ward, this patient is always looking for injection for this. So we found out that the kidney is going, the person cannot handle more painkillers. So when the person is asking for painkiller, they'll give the person water for injection, and you just see the person calm down completely. So they reduced the drug frequency from 6 times a day to like 3 times a day, but they still gave 6 times. But the 3 was real and 3 was not real, just to save the patient's organ from excessive painkillers. And when you go to give the one that is not a drug, you see the patient will just calm down and sleep. I say, this mind is so potent. How I wish we knew how to use it. So, in summary, this one, I lifted it from the book Everything Heals. It says, maintain a positive mind, especially towards your health. Okay. Your healing is activated. Your healing is activated through the state of your mind, not said, the state of your mind. So if you keep a healthy mind, you will have a healthy body to live in. Okay. So whatever the doctor tells you, accept it. But I want to add that I found out in Nigeria, well, I'm mostly practicing in Nigeria, that some doctors don't need to scare you. You know, there's one cancer hospital here in Lagos where when you go, they will just scare you like this. You go and sell your land, sharp, come and pay. There's no need for anybody to scare you. Believe that you will be well, whether you use that, not because you know what I mean. So believe. So if you go to any doctor and the doctor is not speaking the language you understand, go to another doctor. That is why there are many doctors on earth. Your healer is out there. It must not be everybody. You go and doctor is telling you that they are not sure. When you yourself inside your body, you're 100% sure. Let 3 doctors say they're not sure. Then you now go back to that one. But don't take the first doctor says that this thing is not possible. So meditation has, a healing effect. I don't even feel like reading today. I just feel like talking to you today. So all these ones, I lifted everything from the book Everything Heals. But the truth, the word I just want you to go home with is simple. Know the potency of your mind as medicine, and then use those tools. The gratitude, start writing, I am perfectly well. Do it every day. Use visualization, use deep breathing exercises, use those tools. And, we cannot conclude without reminding everybody that even if you use your mind as medicine, you still have to do the needful. You still have to rest. You have to sleep. If you don't even sleep, how would you control your mind? You have to rest. So sleep as medicine. Oxygen, remember we said deep breathing exercises. Deep breathing exercises, it will calm you even enough to use your body and your mind properly as medicine. We, we also talk about water as medicine. Okay, drink your water during the daytime so that you don't drink overnight and be urinating, waking up to urinate. Finish your water early so that you've done your water requirement. Okay, eat raw food, fruit, vegetable, but mostly vegetable, especially after a certain age. Do your detox, such as fasting. And the last one, which is what we talked about today, the God factor. The God factor has to do with your mind as medicine. If you so much believe that, the owner of life, the owner of health, has answered you. It's just with time, you're now going to see all that you're supposed to see. So in conclusion, you have the power over your mind, not outside event. Realize this and you will find strength. Okay. Take a moment today and sit still. As I said earlier, take a deep breath in, breathe out, and remind yourself how powerful or how potent your mind is as medicine. So this is the book, Everything Heals. If you don't have it, try and get one and read the chapter on your mind as medicine. So that is what we have today, a lecture on what your mind as medicine. Hang on one second. Um, one second. Hang on. What do I do now? Hang on. Not to see me. Hang on. Okay, let's see. Okay, here. I want to stop sharing. Okay. So we are okay, yes, stop sharing. All right, perfect. So we are done on our little lecture on your mind as medicine. And I think God will not allow us to be hearers of word, but doers of word. Let's go and use our mind as medicine and just feed on those stories that I told you, practical examples, change your language, change your mind, believe that you're well. 80% of all that you're suffering from is just training your mind and it will now come to life. So I just want to say thank you. And if you have any question, this is a good time to take it. Oh my goodness, a lot of thank you, Dr. Susan. God bless you. The book is called Everything Heals. Gain and Gap. Wow, so insightful. Please get the book. I agree. The name of the book is Everything Heals. Thank you for answering that. Same here. Do it in your bathroom. Praise yourself, praise your body. Can the recording be made available? Yes, the recording is going to be made available. And please, I just want to beg, because we are trying to build a really huge community so that we can do this on YouTube. It will be cheaper for everybody and not just Zoom. If you anytime you look at our video, if you click like and share, I heard it will help expand our community to a point where we can do free YouTube videos and something like that. I'm sorry, I've just been told by my team. Okay, somebody says I'm a living testimony of the lecture. Please, where can I get the book? Okay, we will get back to you on that. We'll place it. Thank you so much. Thank you. Sorry, I'm scanning for questions. No questions, just a whole bunch of thank you. Okay, that's okay. All right, so I'm opening the floor now. If you have any question, concern, or whatever, I will take your question. Or comment, or past experience.
Yeah. Good evening, Doctor.
Hi, good evening. Thank you.
So much. Yeah. Thank you so very much for the training section. It was really very insightful. I just want to ask where we can get the book, because sometimes such books we don't get them in the regular bookstores. So where do you have them in your clinic, or where do you think we can get, or who can we contact to get the book available for us?
We will put the information on the platform that invited you. You can get it from the clinic. I know that is in a couple of bookshops, but I don't have it on top of my head. But definitely in all the Dr. Physic facilities, they have them. I think it's sold for just either 5,000 or 10,000. It's not a massive something, but it's available. So we'll put the information on the platform so that everybody can see it.
Hello, ma. Good evening, ma.
Good evening, sir.
Thanks for the lecture. I'm tempted at calling it Dr. Suzanne's Health Ministry
Oh boy.
because it was something very routine and wonderful exposure.
Thank
I
you,
want
sir.
to find out what is the role of fear in this process, because what fear can do and what faith can do. Because I often say that fear is like forgetting expressly affirmed revelations simply because of a false experience appearing real to you. Hello, man.
Yes. Yes.
Hello, man.
Yes, sir. Okay. Thank you so much for that contribution. You're absolutely right. I should have mentioned something on fear while talking about this. You're right. Fear, I've also heard it defined as future expectation appearing real. I've also heard it as false expectation appearing real. So fear is fear. In this Mind as Medicine, you'll read it in the book somewhere. In the Mind as Medicine, you see, the opposite of healing through the mind is actually fear. So what happens is that once you're afraid and you have fear, sir, your body cannot even heal itself to start with, because number one, as I keep saying it over and over, there are certain non-healing. Hey, hold on, let me see if I can mute it again. It's not allowing me to mute. Yes, when you have fear in your heart, your body is more inflamed. One, your vessels are constricted. You have what they call vessel constrictions. Two, oxygen cannot travel throughout your body. Three, your body is more acidic. Four, and you know that when your body is acidic, that is the manual for all the sickness and every single thing. Five. So the very word fear, put yourself in a state of non-healing to start with. I'm talking from the physiologic, like real biology type of things that happen in your mind when you are in this fearful situation. So if you have fear, you have to just know that, okay, if I am afraid of something, if I'm afraid of this thing, by just being afraid and having fear, automatically you can't be discussing Mind as Medicine in the same room as fear. So I want to ask everybody, if there's something in your life that you're afraid of, just postpone the anxiety. That's what I do for me. Like, you know that your flight is departing at 7 a.m. and you're now leaving your house at 7 a.m. And then you now stay in that hyper state, which is a fearful state that this flight might leave, and you have an American interview in the next hour. You put yourself in that state. That those things that are secreted in your body and everything, you cannot allow your BP to come down. You cannot allow anything to happen. So, sir, thank you for bringing. But just know that, as I mentioned earlier, and I use the word anxiety, that is be anxious for nothing. If you have fear, you cannot heal through the mind. So thanks for reminding all of us. Thank you, sir. Okay, so I will take one last question.
Yeah, I have a question.
Go ahead.
Okay, I think I wrote it down, but let me just say it.
Go ahead.
We talked about drinking water as medicine, the state of the mind as medicine and other things. Now, for ulcer, what are the natural things that one can do to heal ulcer, apart from meditation?
Okay, so all the time in the clinic, what I tell people to do with ulcer is ulcer also is what you eat. Okay, and yes, your mind can actually improve your ulcer state, because if you have a fearful mind or an anxious mind, or like Oga just mentioned, a fearful mind, you'll be producing this acid. If you do cucumber, what I've used for my client, I tell them to do cucumber therapy. Cucumber first thing in the morning and cucumber last thing in the evening, and then drink your 6 bottles of water. It's not overnight. So that alone, it will actually help you. Just cucumber therapy. I've used it for hundreds of patients. Cucumber first thing in the morning, 2 in the morning, instead of medication, and then 2 in the evening, because it's alkaline. It will give you fiber, it will give you alkaline stuff and alkalinize your system and everything. So cucumber has worked for me a lot. Some people also say cabbage, but I've not used the cabbage before. So maybe you can try it, but I want to say cucumber and alkaline water will actually help a lot. Also, you may need to do either endoscopy or colonoscopy to check whether you already have wound in your GI tract. So if you have wound, then you just have to be more patient. Why don't you, talk to me off of this line? The reason is because by the time we are done with this lecture, I want everybody to still be in that mode of mind as medicine, because maybe next week I can talk about GI health, either this week or next week, so that I will cover things like how to get rid of all this bloating, constipation, and all of that. And then I'll bring all the treatments. So I'll do it if it is not this week, because I usually have my presentations ready ahead. If I can alter it, maybe I'll do GI health. If it's not this week, the upper week, we'll do GI health. But for today, it's mind as medicine. So you can reach out to me privately so that I can ask you some questions, and then I can personally help you.
Okay, thank you very much.
You're welcome. Okay, so if
Hello?
it's yes, please go ahead.
Please, I wrote something on the platform. I said I think this lecture has to do with power of the mind, and the power of positive thinking.
Okay.
If one is positive,
Yes.
and you are sure that this will go, it will go.
Yes.
But if you are thinking negative,
Yes.
it is what you is when you think negative, the negative will come up. But
Yes.
when you are positive, that definitely this thing will go, it will definitely go. So I think it's the same thing with mind as a medicine.
Yes, yes, ma. It's along the same line, but the huge difference between that, what you just said, and here is that we've also been able to back it up with science to show some things that actually happen in the body during that state. So yes, you're right. It's also about positive thinking. Okay.
Good evening,
So,
ma. I have
good
an
evening.
experience here.
Okay.
Can I go ahead?
Yes, please go ahead. It's our house now.
Okay. Sometimes last year I wanted to change my family planning. Will I call it PIN or whatever? Because it was 5 years, and 5 years later I wanted to change it. So I got to the hospital and they checked my BP first. So they told me it was I should go. So when I got home, I tried speaking with 1 or 2 women, and they told me that this family planning of a thing used to give women hypertension. And they gave me several women that they already have that hypertension. And I said, my own family planning will not give you hypertension. They said, in your body. I said, even this particular family planning I've done, several women have testified that they believe they do this, they that. None of it has ever happened. I'm not getting fat. I'm just my normal self. Yeah. So one of the women was telling me that, that's why she didn't. I said, you didn't do it. You did not do it, and you're already at number 4. I pity
Oh.
you. And there's nothing on ground. He said, they said, that even the nurses, I said, my own, I will not have BP. So when I come back home to check from a pharmacy beside myself, the woman will check and say, you are okay now, what now happened? So I will drive back again to the clinic. Please mute now.
Mute,
I'll
please,
drive
kindly
back
mute
again
your
to
phone or mute your phone. Can you mute your phone? Oh, hold on, let
be
me.
that I keep going. Okay.
Yeah, hold on.
Okay. So I'll drive back to the clinic and the woman will check again and say, this thing is hard. So at a point when we did like 4 times, so she called me and said, it's like you have fear for hospital. I said, once I enter hospital and I start hearing the sound of those scissors, she can actually say that they call it clinical fear. She gave me one name, sir.
Yeah.
So later she said, you don't have it. So she removed it and inserted another pin, another 5 years pin. So she now told me that I should please just be mindful of myself concerning the big mistake. I said, okay, no problem. So I started checking and I kept telling myself that I know I'm asthmatic, but I will not have this BP.
Yes.
It is never my portion.
Amen.
Now, where I'm going was, so I normally go to the church clinic to check. So there was a day I got there. I didn't use the elevator. I used the stairs. So when we got there, they checked my own and they checked one other woman's phone. And the lady told me, your BP is. I said, that's not my own. Let me go and rest. It's not my own. So the other woman accepted I was looking at her. So we were on the queue. So they checked my own later and she now saw that, okay, this is normal. So we were on the queue to see the doctor. She started lamenting beside me, this Lagos, why won't somebody have BP? You will go to work in the morning. I was just looking at her. So when we entered into the doctor's place, she came out, she entered first and came out with all these drugs. There's this particular drug that once you see it with you know that this person has BP. So I was looking at her that you've already accepted. This is not my own portion. So by the time I entered into the dog, I said, okay, you don't have, but continue to watch. But what I want to say tonight is that with the power of the mind, I make sure that I check all the time. And because I have refused to accept it, in fact, when I see results, I say, what happened? And I didn't take any drug. I just refused. And the thing just keep coming back to normal. So when I started listening to the lecture this night, I said, I will not accept. So even my husband too, I will start saying it in my mind that I will not accept. It will go. And so shall it be. Thank you very much.
Oh, thank you for that beautiful testimony. You know, the truth is that we can learn from you. One thing that we must all learn from her this night is what I even missed out to say. Even while you're in the corridor of believing, you should still check. You see, even though she kept checking, and it's not that, okay, I don't believe, and then you now don't even check again. You can check. But when you check, no matter what you see, she said something, it is not my own. That is that, before I talked about owning your disease detached, not I am a beep beep, I am you. She's a little detached, and the good news is that since she's checking, if it ever, which we believe it will not come, get to a point where she must do something about it, the doctor will be just there to do something about it. But she has now said now that she's also going to carry this type of attitude towards her asthma and start detaching it from her system, etc. The truth is that once you don't accept something, even if it's a female, you don't like her, eventually she'll disappear from your life. If it's a man, you don't like, what you like and own will stay back. And what you don't like and you don't own will also find its way out. So I want to, because of time, because I want everybody to always want to come to the lecture and not think that I will drag it out forever. I want to thank every single person for
Please,
coming.
Dr. Susan, I have a question on the platform. You have not
Okay, what's your question, please?
Good evening. Thank you so much. God bless you. It's about the knee, the arthritis on the knee. There's the person is on bone and bone and has been in severe pain, and she's been scheduled for an ACAP replacement.
Oh. Okay.
So in such case, what's the solution?
Okay, perfect. Like I said earlier, I would like for you to take my number and please reach out to me directly, so that way I can tackle it separately, because this is a very, I have to understand a lot of things around the person, and then I can give you specific solution. If it's just a mild arthritis starting here and there, then I can give a general. But if it has reached a point where they have done surgery and the person has been doing bone broths, etc., I think we should talk offline. So please take my number, reach out to me on the WhatsApp, and then we'll now take it from there.
Your number is the one on this platform?
Yes.
Okay, thank you so much. God bless you.
You're welcome, dear. Thank you so much. And the ulcer person also should also reach out to me as we conclude. Please reach out to me. I will help out. Okay, so once again, I started with a very powerful story about the woman who came with cancer, hypertension, diabetes, and how we taught her how to shrink everything. And then we gave several examples of how you can use your very mind to heal yourself. And we also talked about the fact that whatever you're thinking and believing in your mind, you're secreting it. So I gave a vulgar example of if you're thinking of a woman and sexual stuff, you can get erection. If you're thinking of sadness, you can secrete tears. If you're thinking of a very delicious food, your mouth will be wet and you start salivating. So that means that if you are toxic in the mind, in terms of not believing negatively, things are happening in your body that whether you're conscious of it or not, I use those examples to show you that it's happening. So we have now given the tools for you to free your mind. The first tool could be your journaling. Just keep writing repeatedly what you want to see. Just keep writing and thanking God for it. Just keep writing. We have used visualization and seeing your body totally sickness free or better in health or living to be 100, or just pick your picture and stick with it. And we added that when you pick that picture, if something interruption happens, don't remove your mind from the fixed picture. Then we talked about deep breathing exercises and relaxing your mind to make right decisions, etc. So we talked about some tools. There was a question on fear. If you don't remove fear, you can never enjoy the benefit of your very mind as medicine. And finally, I always pray for you, and I will ever pray for you. I want it that just because you invest an hour of your time that you'll never ever get back on this program with me, that the same God that is helping me will also help you to have a very sweet health, nice life, sleep well, enjoy your life, and then we continue to see how we can live together and grow our community and do what God put us on earth to do and actualize our vision and our mission and our purpose in life. So I want to say thank you for coming out. Have a good night. We'll share the video. You go to YouTube, you listen to it. And before you sleep tonight, as a homework, please just close your eyes, sit still, and do a small visualization of how you want your life to be. And by God's grace, take it from there. Have a wonderful night. Until we see again, God bless you. God bless you. God bless you.